So, omega-3 fish oils are frequently recommended by eye doctors and dry eye specialists for the treatment of dry eye syndrome. But the big question is, of course, how much omega-3 fish oil is recommended in the research to make a meaningful benefit? Well, I'll tell you straight up, most of the research does show and support that the use of around 1,000 to 3,000 milligrams of EPA and DHA omega-3 is somewhat helpful for dry eye signs and symptoms. But I will share there's a lot of nuance to that research and other questions about omega-3s, such as what are the sources of omega-3 that you're getting? Are you getting it from fish sources? Are you getting it from algae sources? Are you taking supplements? There's also a lot of questions about what omega-3s you're purchasing and what the bottle says. So in tonight's live stream education, we're going to be breaking down a lot of those questions. We'll also be shedding light on omega-3 testing and how to confirm if the omega-3s that you may be getting, whether it be from fish sources or again from a supplement, are in fact getting absorbed into your system and benefiting you. And we'll be answering questions about like safety and how much is too much and who needs to be kind of concerned about those sort of things. So if this is your first time to our education, first time meeting me, my name is Dr. Joseph Allen. I'm a board certified doctor of optometry. I'm also a fellow of the American Academy of Optometry and a diplomate of the American Board of Optometry, as well as a board member of the Ocular Wellness and Nutrition Society. A lot of people know me here on the internet, on YouTube, Facebook, Instagram, TikTok, because I make a lot of educational content around eye and vision care. And that's part of my mission to help people learn about the eyes, vision, so that they can keep seeing their best, not only today, but also tomorrow. In addition to this, yes, I do still see patients. I see patients at Grove Eye Care here in Richmond, Virginia, and I see a lot of patients for dry eye. And so I'm excited to be sharing this information, more details about omega-3s. Now, we also have the Dr. Isles podcast. So if you're somebody who also likes to listen, whether you're working out at the gym or you're commuting, then that's another great resource for information if you want to learn more about eyes and vision. So when it comes to omega-3s, I want to be straight up and give some value to. So in general, it is often recommended that they are helpful for dry eye, but it may help some people more than others. And I share that because I have some patients who swear that omega-3s was the game changer for their dry eye. And I have many viewers on social media who've also commented that same thing. And I do encourage you, if you're catching us live right now on the live stream, let us know in the comments if you, one, take omega-3s, and two, like how much you take. And if you've ever felt that it made a difference for your dry eye symptoms. I think that would be really interesting to see kind of people's thoughts and kind of reactions to that. When it comes to dry eye and omega-3s, again, there's a lot of nuance. And in tonight's education, we're going to dive into some of the science and some of the research about this. I do want to mention omega-3s are usually best part of a whole treatment plan. So it's not just a silver bullet that's going to make the biggest change. Most of dry eye is very complex. There's many different drivers to dry eye. And so one person's dry eye is usually not the same as another's, and not everybody responds the same way. And so we'll kind of share where this nuance can be. Whole food for dry eye, or I should say whole food sources of omega-3s are largely still recommended and is considered a foundation, right? I quote my girlfriend who, she's a scientist, she's an eye doctor too, and she often says she loves science, but she doesn't like to eat science. So I think eating whole food is always the foundation. Again, around 1,000 to 3,000 milligrams of EPA DHA daily is frequently recommended in the research, but we'll kind of show some of that. And then dietary changes or supplementation, it does usually take several months of consistent use to start seeing benefits. And that actually goes back to just how omega-3s get absorbed into the system, into the body, before they start making changes. So just like hitting the gym, You can't think, oh, I'm going to go lift weights one day and be like, I'm done for life. I don't need to do it anymore. It's something you need to consistently be about. And I'll even share some personal tips of things that have helped me remember to take my supplements and to be better about my diet and omega-3 consumption, because I think a lot of us probably have done that at some point. We started either a I don't know. We started either a fitness program or started taking a supplement of some kind, or even a medication, and it's sometimes easy to miss. Uh, the other thing is omega-3 testing. We'll be talking about omega-3 testing and ways you can measure to see if you're in fact absorbing the omega-3s that you're ingesting, whether it be from whole food sources or from supplements. So let's first dive into like why omega-3 fatty acids. Omega-3 fatty acids are often recommended for many things: for your heart health, for skin health, brain health, the retina in the back of the eye, and of course, for a dry eye. And the reason for this, it really falls down to inflammation. Now, I have some kind of graphs I'll be showing in the next two slides. I don't want to overwhelm everybody. The mechanisms get very complex. They've been studied for close to 50 years. Just understand that omega-3s, when you eat them, they get incorporated into membranes of the cells in your body. And your body will break down those membranes to make signaling molecules that help orchestrate how your body responds to inflammation. So whether you get mechanical damage to tissue, chemical damage, or you have an infection, your body will respond with inflammation and different immune cells or white blood cells to either react very fast and with a lot of responsiveness, or even for a long period of time, it'll maintain that high level of inflammation. But omega-3s, they interject and kind of influence this one spot I highlighted in red. They influence this one spot, and it gets, again, very complex. I only put this slide on here. I know it's like, whoa, there's a lot going on. I put that on there, especially for any doctors, any researchers who are interested in, or anybody who's just interested in knowing a little bit more of the cascade that affects the eye. But it does get a bit complex. So we'll share, this is like a simplified still diagram of how omega-3 mechanisms influence inflammation. But omega-3s, especially for dry eye, are believed to reduce inflammation. They're to improve the tear film stability, as well as improve meibomian gland secretions. So this little video, I'll see if I can make it larger. The video you're seeing right here is of a person blinking in the eye clinic. And we put a little fluorescein dye. It's a green dye that stains across the ocular surface. And what we're seeing is the tear film stretch and thin out in between blinks. So if you look at the center, the patient will blink, and you'll see this dark spot start to appear. And it's really the tear film spreading across. And it's within a few seconds. So here, when they open, we can count 1, 2, 3, 4. So in around 3.5 seconds, that dark spot starts to appear on the central part of the eye. So that procedure in the eye clinic, we call tear film breakup time, or TBUT. And that's a way we see how stable somebody's tear film is. But the big question, of course, especially when you get into the science world, whether you're a doctor or just kind of interested, okay, what does the research really show? That's really where, you know, how they say, the gravel meets the road, or the tires meet the road. So we don't have time to go over every single study. I'm going to highlight a few big ones. Just know that largely, some studies show that omega-3 supplements, or just taking omega-3s, is associated with better tear film stability, improved tear production, so you're making more of your own natural tears, as well as reduced symptoms in certain patients. The big caveat, and I think it's always fair to share both sides of the story, is that there are some high-quality studies that show no meaningful advantage compared to some placebos. Now, oftentimes the placebos used in those studies are olive oil and other things like grapeseed oil. And there's some debate if those are true placebos, or if they also carry their own anti-inflammatory effect. And maybe that's why they just don't see a strong, meaningful benefit versus the omega-3s. Probably the largest study that was casted shade on the belief of omega-3s being beneficial for dry eye came from the DREAM study. It was published in 2018 in the New England Journal of Medicine. They used 2,000 milligrams of EPA, 1,000 milligrams of DHA of omega-3s compared to a control group that had just olive oil, and they followed for 12 months. Now, this was a real world study, and by that, it means that people were allowed to take medications. They're allowed to continue taking all treatments for dry eye, artificial tears, medications, everything. They just started adding omega-3s or this placebo to their treatment. And after 12 months, they looked at the data and they found really there wasn't a significant difference compared to the people just taking the olive oil. I will mention, if you go back and look at the data, the symptoms did improve for everybody in the study. And there were some improvements in clinical changes, but just compared to olive oil, there wasn't a significant difference. Another study that just came out in 2024 in JAMA Ophthalmology, they also looked at a similar type of treatment. They used 1680 milligrams of EPA, 560 milligrams of DHA, and they has a placebo of grapeseed oil. Again, if I love showing at least this graph here because you could see the symptoms, or what we use in the eye clinic as OSDI, ocular surface disease index score. They improved in 6 weeks and at 12 weeks post the treatment, but for both groups. So both the people using the grapeseed oil and the omega-3s had those improvements. In fact, their symptoms of dry eye nearly improved like double, like their symptoms decreased by half. But again, not a significant difference versus the grapeseed oil. On the other side, there's in fact quite a lot of publications showing positive benefits for dry eye from taking omega-3 fish oils. This was one here in 2023, came from an Indian Journal of Ophthalmology, and they used 1440 milligrams of EPA, 960 DHA, and versus the olive oil. And over the course of 6 months, they reported significant improvements in the people using the not the olive oil, but the omega-3s. And that was in symptoms of dry eye, tear production through Schirmer's score, tear stability with tear film breakup time, like we just kind of simulated here, tear osmolarity, as well as goblet cell density. And goblet cell density, for me, as somebody who sees a lot of dry eye, goblet cells are little cells on the surface of the eye that produce mucin. That's more of the mucousy, sticky substance that holds the tears to the surface of the eye. And we tend to see changes in goblet cell density when somebody has chronic inflammation and potentially even autoimmune conditions. So if we have any evidence of medications or other treatments that can improve goblet cell density, I'm really excited for my patients who are struggling chronically. Now, again, we don't have time to go over every study that's been for or against omega-3s, but I think this is good to take a look at. This is 2023, the Journal of Clinical Medicine. This was a meta-analysis and systematic review, and they had 19 randomized controlled trials. So they compiled all this data, 4,000 people in this like combination, and they included the DREAM study. And what they found, still significant improvements in symptoms, tear stability, in the tear production, and tear osmolarity. And so this is still one of the major studies that I think a lot of professionals do put weight on. They're like, hey, if we look at all this data, it's still largely supportive still for benefits for dry eye. And even in the most recent, what we call the TFOS, or Tear Film Ocular Surface Society, in their DEWS 3 publication that came out last year, it's kind of the unofficial Bible in a way of dry eye management. They still discuss omega-3s heavily and support it as an adjunct, as part of the treatment protocol for dry eye. So largely, evidence-informed summary for dry eye. Dietary foundation, fatty fish twice a week is still often recommended. And this is not just for dry eye. This is for general eye health, as people who consume more fish in their diet at least twice a week have been found to have reduced risk of aging eye disease like macular degeneration. Same for people's symptoms of arthritis in their hands and their joints. Eating fish twice a week is still considered positive. Supplements, again, the research varies, but somewhere between 1,000 to 3,000 milligrams combined of EPA DHA daily. And we'll break down EPA and DHA in just a moment. I will share in my personal experience, somewhere I personally take around 2,000, 2,200 milligrams of EPA DHA daily. And that's what's worked really well for me. But it is often in the studies evaluated to have benefits after about 3 up to about 6 months. And again, that has to do with how omega-3s are incorporated into the phospholipids of cell membranes throughout the body. If you do want to know the references and you want to dig deeper into the research, or if you just want to check to make sure I'm not making things up, we do make the references available, and we'll have that in the show notes as soon as we're done with the live stream. A little bit more on EPA versus DHA, because I know when you look in the back of fish oils or omega-3 supplements, they break this down and it can be a little confusing. Both do matter, but I will share they share different roles. EPA and DHA both involve in inflammatory signaling and altering that throughout the body, but DHA is more densely packed in the brain and in the retina in the back of the eye, which the retina is really just an extension of the brain. But it supports neural tissue. They've even found that DHA can help support the neural tissue in the nerves that go to the cornea that help the eye heal. It sends the signals from the brain to the cornea to heal that tissue. But the EPA and DHA balance, or the ratio of EPA DHA, has not fully been established or definitively set to be proven superior in one way or another, specifically for dry eye. Some studies have higher EPA, some studies have higher DHA. A lot of the studies don't give a rhyme or reason of why they chose that. A lot of times it's just because that's what was given to them for the study. I personally do look for a 1-to-1 ratio of DHA to EPA or EPA to DHA, and that's based off of some guidance from neurology and some other specialists in the more brain side of field. And I want to make sure that I myself am getting at least enough DHA in my diet and supplementation. So I did want to share this guide because I know a lot of my patients who come in, either they know they're taking omega-3s, but they don't know how much they're taking. And sometimes they're really confused, or it's even myself. I've been to the store and looked at all the different brands on the shelf, and it's confusing of how to make sense of what is you're actually getting. So if you look at the label on the front of a lot of omega-3s, it'll just say fish oil, right? On this example, it says 1,000 milligrams of fish oil. But if you look at the nutrition fact label on the back, you'll see total omega-3. And if the total omega-3 is way less, then you're probably getting a lot of filler oil in those fish oil supplements. And so in this example, it could be 1,000 milligrams of fish oil on the front, but in the back, it'll say total omega-3, 320 milligrams. So what's in that other like 2/3 of the capsule? So that's a big thing just to recognize, that fish oil does not necessarily equal omega-3. Another thing to look at on the bottle is it in ethyl ester or is it in what is RTG, or re-esterified triglyceride form? There's been a large debate over this. Ethyl ester forms are an alcohol. It's the way they manufacture omega-3s. The ethyl ester form is cheaper to manufacture, and you can still absorb it, especially if you take it with food and other fats. However, it is often associated with other side effects and symptoms, like burps, indigestion, constipation, bad taste, vomiting, skin rashes even, where re-esterified triglyceride form is much closer to the natural omega-3 form that you get when you eat just whole fish. And so you do absorb a little bit higher levels, and you may see better improvements in omega-3 testing when you take re-esterified triglyceride forms. And they tend not to have any of those other side effects. So let's talk about dietary sources, because there are different sources beyond just taking supplements. If you let me know if you've ever heard of SMASH, This is the acronym for salmon, mackerel, anchovies, sardines, and herring. And that's an easy way to think of the food that commonly has higher amounts of omega-3s. I will share that I just tried herring a few months ago. I was in the Netherlands where eating herring is kind of like a delicacy. And I gave a lecture there, and one of the other doctors brought me some fresh herring to try. And I will share, like, I was not ready for that taste. It is very oily, but it was actually quite good. I loved it, especially with they had like raw onions and things with it too. Uh, Fish roe, I wanted to add on here because if you start looking at other types of omega-3s, there's the cutting edge research around very long chain fatty acids. Omega-3s are considered long chain fatty acids, but there is some research on very long chain fatty acids and of phospholipid omega-3s. And fish roe has a slightly higher amount of at least phospholipid omega-3s, and they may have some benefits for crossing the blood-brain barrier and the blood-retinal barrier, specifically for like retinal health. There's at least a lot of benefits in preclinical studies. We're still waiting for human studies and that evidence to come out, but that's kind of where the doctors and researchers are currently kind of debating and kind of waiting to hear more. I will share that some people are concerned about the either overfishing of the oceans or even overconsumption of heavy metals, things like mercury, PCBs, microplastics that could be in fish, and eating whole fish a lot throughout the day or throughout the week. They have found that eating twice a week is largely considered safe as long as somebody's not eating more of the predatory fish in the ocean, like shark or swordfish. They may contain higher levels of heavy metals like mercury. But otherwise, eating at least twice a week of these fish sources is considered recommended and healthy. If somebody does not like to eat fish or even take fish supplements because either they have an allergy or there's ethical reasons, if they eat a vegan lifestyle or they're worried about the ecology of fishing practices, then there are plant sources of omega-3. However, we don't call them EPA DHA, we call them ALA. It stands for alpha linoleic acid. And you get this from ground flaxseed, chia seed, walnuts, some canola oil, and soybeans. However, the concern is that the conversion in your body of ALA plant source omega-3 to EPA DHA is quite low. It's somewhere around 4 to 8% in the literature. And so I'll even share in a little bit, I ate a vegan diet strictly for 3 months and then ate largely a whole food plant-based diet for several years. And I wasn't sure if I was getting enough omega-3. So I did my own omega-3 testing and I found my score was very low. And that was one of the things that started changing my own diet to incorporate a lot more natural fish and even taking fish oil supplements. For people who don't want to take fish oil supplements, they do have algae-based omega-3s. That's because fish actually get their omega-3s from the food chain, starting with algae. So that is an alternative. So let's go back and think, how do we know we're getting enough? Whether you're eating or getting omega-3s from fish or you're taking fish oil, how do you know you're absorbing what you're getting? In the weightlifting fitness world, we often say that you are what you eat, you are what you absorb. So you got to know. So one option is that of the Omega Quant test. This is an omega-3 index test. There's a few different brands for omega-3 testing on the market. This happens to be just the one that I personally have used and had success with. In fact, I actually had an email yesterday from this company, and they did offer they actually have a sale going on right now. So normally I put a little, if you look on screen, I have a QR code. If you want to scan that, they do have typically a 5% off code with going on, but they actually have a 15% code going on this week. So if you want to test your omega-3s and see where you're at, whether with your diet or what omega-3 supplements you may be taking, that is at least a resource to check. So when I first tested mine, when I hadn't been taking any fish oil supplements, I was around 4% omega-3 index, and that's considered really low. the omega-3 index is based off of research mostly for cardiac health, and they want you to be between 8 to 12%. And so for me, it just was at least an understanding I wasn't getting enough omega-3s. Now, we don't have a set omega-3 index for dry eye, but we can use it as a proxy to make sure that we're absorbing omega-3s, however you're getting them in your diet. So this was my second test after I had been taking omega-3 fish oils consistently for about 3 months, and my score went up to 9.5 or 9.5%. So that was great. Now, I do have a couple of videos that I've made on YouTube about my journey testing omega-3s and even testing my own dry eye parameters. They're kind of fun experiments. If you want to check out those videos, again, we'll put links in the show notes for you if you want to see that. I will share that omega-3, I've done both the basic test and then they have the complete test. The complete test I do find value in. It's a little bit more expensive, but they do give you a lot more insights into not just omega-3s, but omega-6s. They give you insights into saturated fatty acid content, your trans fats, if you're getting any of those, even your arachidonic acid levels, which we didn't talk about yet, but that's something that is often associated with inflammatory markers throughout the body or concerns about inflammatory markers. So let's talk about just where omega-3s fit in, specifically with dry eye, because dry eye is so complicated. I will share that I haven't really met any eye doctor or dry eye specialist who thinks that omega-3s are a silver bullet. A lot of doctors consider them just part of the treatment plan because patients often still need lubricating drops. They need to be taking care of their eyelids, cleaning their eyelids, perhaps doing warm or cold compresses. There's environmental factors, right? How much time do we spend on the computer screen or our phone and not blinking as much? How much other environmental factors like allergies are playing a role? There's also medications, in-office procedures, and even other medical history, right? If you're somebody who has an autoimmune condition, perhaps something like diabetes, that can all play a role along with all the other medications that you can possibly take. Because if you look at the side effects of like most medications, they all say, hey, dry eye may be a side effect. So it's something that I think it plays a role with everything. I think of the outside environment as something that can definitely affect our eyes because our eyes are exposed to air and everything around us. But what we eat in terms of food and or take supplementation, that's our internal environment. And that can also affect so many different parts of our body, including inflammation and healing. So some safety and quality things to keep in mind if you're going to be looking into taking omega-3 supplements yourself or learning a little bit more. Definitely speak with a healthcare professional first if you have any bleeding disorders, if you take anticoagulants or antiplatelet medications. And this is because higher levels of omega-3 supplementation has been found to thin the blood a little bit. If you have a history of atrial fibrillation, it's something to consult with a healthcare provider for, especially if you have a cardiologist. There are some studies that show that when taking higher quantities of omega-3s, atrial fibrillation is slightly higher risk, especially for people who already have some sort of cardiac history. If you're preparing for surgery, there's some debate over that, but still good to mention to all healthcare providers that you're taking an omega-3 supplement. If you, of course, you have a shellfish or fish allergy, if you're pregnant or breastfeeding, but I actually find in a lot of the more current research that especially DHA omega-3s, because they're so good for brain and eye development, they're often recommended for some pregnant or breastfeeding women. But again, always consult a local healthcare professional about your health situation. And of course, if you're taking prescription omega-3 medications, because there are 2 omega-3 prescriptions for cardiac or cholesterol health, which is an option for some people. I did want to mention for anybody who wishes to experiment, I have some people who've commented on social media that they take very high levels of omega-3s. And I just want to mention that the US FDA, the Food and Drug Administration, does recommend not consuming more than 5 grams a day of EPA DHA combined. If you are taking a higher dosage, I would say anything over 3 grams a day. Again, best talk to a healthcare professional first, just because there are potential side effects and interactions with medications in certain health conditions. Other things to think about when you're shopping for omega-3. So right now on the screen, I have this bottle that's clear. I always give kind of a watch out if you see a clear bottle, because light, heat can denature oils and change how stable they are. And that's said for a lot of different supplements. I do think it's important to look for clearly listed EPA DHA quantities. You also look for independent purity and contamination testing. Didn't know this. I didn't learn anything about supplementation really when I was in school. As an eye care provider, you learn about fundamental studies about macular degeneration, but they really don't teach you anything about diet. They don't teach you about nutrition, supplementation, or certainly the business of supplementation. And as I've dug deeper into the research, because I've here on social media, I have a lot of people ask about like what I've recommended, and I want to make sure I give the best information possible. I found out there's a lot of counterfeit and like scam supplements on the market. I've seen statistics that as high as 30 to 70% of supplements on the market can be like counterfeit or expired or contaminated in some way. So I think finding a reputable company that does independent testing or third party tested, that is validated for sports if you're an athlete, right? Because they always do blood testing for like professional athletes. They want to make sure that the supplements that they're taking aren't actually like a doping sort of thing. Of course, check for expiration dates and appropriate storage. And again, make sure you can use a formulation that you can tolerate. I know people who take the ethyl ester form and they eat it with food and they feel fine, but I know a lot of people don't, and they get upset stomachs from it. And if you can't handle it every single day, then you might want to find a different type of omega-3 that you can take reliably and consistently with your regular, just daily routine. Now, just to kind of summarize before we jump into Q&A, because we are going to do some live Q&A for everybody who happens to be here. So prep questions if you have any. Just the 5 things to remember about omega-3s and dry eye. Omega-3s may help for some people. The evidence is mixed, but is largely still considered supportive and beneficial for people with dry eye. It's still, either way, even if it doesn't help with dry eye, it's still recommended for overall eye health and many other health things throughout the body. I do suggest focusing on combined EPA DHA, not the total amount of fish oil. Again, you want to look for around 1,000 to 3,000 milligrams of EPA DHA combined. Food sources, especially fatty fish, I still think and should be part of the foundation. And then omega-3s, again, are part of a comprehensive dry eye plan, not in just a place of one. So do not just take my word for it. Always consult a local healthcare professional in your area. See an eye doctor, a dry eye specialist, if you can find one in your area, so that they can not only give you a proper diagnosis of what's going on, but then recommend a treatment plan that's going to work best for you. Dry eye is super complex, and I've seen it so much over the last 11 years of practice. Again, we often say in the field of eye care that dry eyes more like 100 different conditions under the umbrella of the term dry eye, and so that's one of the reasons why it's so complicated. Now, we're going to be diving into some Q&A, but for additional resources, check the show notes, because we'll have in there not only some product discounts, products that I have used and found success with and recommend. And we often have additional resources, including, all the resources cited if you want to dig into the research yourself. Now, this is not a sponsored event. This is not a sponsored episode or live stream in any way. But one of the most common questions I get from not only patients in the clinic, but people here online is, what supplement do I recommend and do I use? So I've used several in the past, but the one that I use right now and have had the most trust in is through the company called MacuHealth. They have been a sponsor for the channel in the past. They are not sponsoring this particular episode, but as a gesture and courtesy for all of our followers, listeners, they have offered a 20% discount for all of their products. on their website. You just have to use the code Alan Summer and you get 20% off. That is not an affiliate code. I do not generate any revenue. The business myself, I do not generate revenue off of that discount code. That is simply a wonderful gesture by MacuHealth, and a huge thank you to them because they have supported us in the past. If you don't want to use that code, you don't want to use MacuHealth products, you can look at other ones and do your own research. But if you do choose, you're like, hey, let me try something. That happens to be a company I know that does really good job of following the science. They also are very transparent about where their omega-3s come from. They're certified for sport, and they are independently tested and verified for the quality of their products. So that's one of the reasons why I've been working with them, and one of the reasons why I choose to take their products. So again, if you want to use that, Alan Summer will save you 20% off. We have a QR code on screen if you want to check out their website. Beyond that, we are going to spend a few minutes doing some live Q&A. I do always give a medical disclaimer. I cannot give personal medical advice during Q&A. I can only give answers around education, because that's really what we're here for, to provide education, to help people learn about the eyes, vision products, all of these things. But for you to have the best medical care that you deserve, you need to see a doctor in person in your local area. You can't just try to reach out to somebody online and hope that they can give you some guidance. So if you have questions, I'm going to always answer in a way that's educational for everybody. With that being said, thank you so much for being here. I hope you learned something. If you can, if you're following us on any channel, please hit the like button. If you're new here to the YouTube channel, subscribe if you have not done so already. Also, consider following us on the Dr. Eye Health podcast on all the podcasting platforms, including Apple and Spotify. So I know we've got some questions coming in, so thank you guys so much for being here. First question we have is, I'll see it. We have, is it normal for one eye to be nearsighted and the other eye to be farsighted? This is a good question. It is actually quite normal. Some people do have an eye that's farsighted and one that's nearsighted. The challenge is that at a young age, if the one eye is dramatically different than the other, especially the farsighted eye, usually a young kid may prefer to use the nearsighted eye more often because a lot of our world is right in front of us and it's less effort to use the eye muscles. And so the hyperopic eye may be at risk of a condition called amblyopia or lazy eye. And so that is something that needs to be addressed. If the difference between one eye and the other eye is dramatic, there can be magnification or minification changes, especially with glasses wear. And so sometimes people with that big difference, they are often best treated with contact lenses or even refractive surgery in some cases, just because glasses can create an optical distortion that can give people headaches or two separate sized images that don't match up, kind of like a small hand and a large hand. They don't quite match up, if that makes sense. So thanks for that question. This one, I'll see here. We do have Janice. I'll actually be able to show this one up on screen. Is cod liver oil good for dry eyes? This is a really good question. So cod liver oil has been recommended for like generations, right? It was like my great-great-grandfather's, cure-all. They'd recommend, cod liver oil for tons of different things. Cod liver oil does have some omega-3 content in it. It's not as high as today's more like the distillation processes and purification processes for omega-3s today are a lot higher, but cod liver oil does have some omega-3, but it also has vitamin A in it because the liver is where most vitamin A is stored in animals. And so for people who happen to be deficient in vitamin A or low in vitamin A, that may be a benefit. The only caution about cod liver oil and all supplementation of vitamin A is you need to be mindful that you can overdo it. Hypervitaminosis is a real thing. And when people get too much vitamin A, it can cause funny enough, dry eye is listed as a symptom of too much vitamin A, and it can cause other issues like increased intracranial pressure, which eye doctors will see as a swollen optic nerve. And so there are always, some caveats to all of that. But I'm interested more in the cod liver oil myself, and I'm kind of interested in maybe doing like a self study. I'll probably have to maybe see what would happen. I'll have to test my like vitamin A levels and maybe start taking cod liver oil and see if my dry eye parameters change at all. It would be a really interesting. I think it'd make an interesting video and self study. So thank you for that question. That is a good one. I think this is just more of a comment, but thank you, Barb and Birds. I'm on an antipathy this med, and it has given me severe dry eye with burning. So I'll just share a lot of medications of all types can cause a lot of dry eye, burning sensations. There are some medications now, such as perfluorohexyloctane, that's the generic name, that can often help for a lot of people. There's other types of prescription medications for dry eye, which we're in, I would say, like the fourth or fifth generation of dry eye medications, and they're making such a significant difference now compared to what we only had 20 years ago. So I would say if anyone's listening in and you haven't had an evaluation or seen an eye doctor for dry eye symptoms in a while, even if you've tried some of the medications previously years ago, we now have just way better medications, and I'm seeing a lot more great success with my patients with just those medications. So thank you for asking that. I like this one. Is eye exercise a thing to improve focus and eye health? That's a really loaded question because there's a lot of misinformation around eye exercises, I feel, especially on the internet. In a very broad sense, if someone does just general eye movements, and I think just getting away from computer screens, getting away from being indoors, get some time outside, give your eyes a break from just staring at a near device, your eyes are going to learn to relax the muscles and not feel as fatigued and tired. There is some evidence that doing vision training programs, like sports vision training programs, can maybe improve focus and attention. There's certain places for eye exercises, or what we call vision therapy or orthoptics, for training people post traumatic brain injury, as well as post concussion and different scenarios, as well as developmental issues with the eyes and not being able to use them and coordinate them correctly. Really, it's a subspecialty of eye care, and unfortunately, I think there's a lot of misinformation about that on the internet. So I have a few videos diving deeper in it that have more resources and research if you want to dig into it. But hopefully, in general, it's usually not going to hurt, but it's something that I do think it's worthwhile to talk to a local professional about so that they can assess if there's a risk, if doing eye exercises of any kind could potentially make symptoms worse. This is a good question, just in general. And this will probably be our last one, I think. And that's that: how often should you get a new pair of glasses if you haven't gotten a new pair of glasses in a few years? I think it depends. Your eyes can change from year to year. Some people, it changes faster than others. There's so many different health things that impact somebody's vision. I think if you get an assessment and the glasses prescription haven't changed that much, and you're still seeing relatively 20/20, then it comes down to, and this is just general for people, if you're still seeing well, it comes down to how damaged the glasses are, right? Are they still in good shape? Are they falling apart? Are the lenses scratched? And then if you just want something that is more comfortable or in a new style. But I think it's worth to have your eyes examined and have a routine eye exam, a comprehensive eye exam, to make sure things are healthy. And then as far as the glasses, if they're in still good shape, I tell my patients, yeah, they're still in great shape. I'd still keep using them, but at least you have an updated prescription in case you break them, you lose them, or you just want to get something new. So hopefully that helps. I see, I'm sorry, I missed two questions, our last two here. We'll pull them up. We got Katie. What is the best fish to eat? And And then what about fluorescein? So the best fish to eat. It's tough to say what is the best because there's a lot of variance of where it's fished. Was it farmed? Was it caught wild? Uh, is it something that you have cooked? And then how you cook it can also change some of the omega-3 concentration. Taste wise, I love salmon. However, when I've done my own omega-3 testing just purely off of eating salmon twice a week, I never found it to reach above 5% on the index. I have heard a lot of good things about sardines and having a good ratio of EPA DHA in sardines. So I'm starting to incorporate sardines a little bit more often, but they're an acquired taste for me. So I have to do more of an experimentation with other like charcuterie style. Like, should I try it with mustard? Should I try it with relish, hot sauce, all those different things? As far as fluorescein, we use just a little bit of fluorescein on a fluorescein strip to put into the tear film. In research studies, they have very specific kind of micro pipettes that they make sure they're getting the right amount of fluorescein in every single time in the research. And we use that for not only checking pressure of the eye, but for assessing for dry eye, if there's been damage or like a scratch on the eye. Even viral infections will show up on the eye if we stain appropriately with fluorescein sodium. People can also get fluorescein sodium injected, and we do that because we take photos of the back of the eye because you can see where the fluorescein sodium travels through the retina. And that's usually used in retina clinics to evaluate if there's bleeding or new blood vessel growth in some area. It can, unfortunately, fluorescein injected can make some people, there can be side effects, and some people throw up or they get sick from it. So that's unfortunate. It doesn't happen too often, but it is something we have to always give people warnings about. So thank you for that question. Let's see. I know we got a couple more questions coming in. I know I'll just mention that Julie here, she mentions flaxseed oil, and there is at least one publication on high doses of flaxseed oil and helping with dry eye, but it was a lot. It was closer to like 4,000 milligrams of flaxseed. But happy to hear that. Yeah, Julie mentions that she takes like 2,800 milligrams of flaxseed oil, 4,500 milligrams of DHA EPA fish oil. So definitely on the higher end. But I'm happy that it's made a huge difference in your dry eyes. It's great news. I will mention here, we have Bernard asks about thoughts on mesozeaxanthin. So mesozeaxanthin, that's like, we're opening up a whole another chapter of nutrition for the eyes. So the major carotenoids inside the eye are lutein, zeaxanthin, and then there is this mesozeaxanthin. Lutein and zeaxanthin you get from eating mostly different types of plants like green leafy vegetables. There's a little bit in some like yellow orange peppers. There's some in egg yolk. In fact, a lot of the lutein you get in egg yolk is in fact supplemented in chicken feed. They actually breed or cultivate different types of corn that have higher amounts of lutein in them so that they can feed it to chickens to boost the yellow orange color of egg yolk. It was fascinating. I went to a brain and ocular nutrition conference the other year and got to hear some PhD lectures on so many things about different types of carotenoid and lutein supplements that I had never learned about before. So mesozeaxanthin, the cells of your retina will convert lutein to mesozeaxanthin naturally. There are some publications that show that some people may not convert that efficiently and may be missing and not even developing much mesozeaxanthin at all. What's beneficial is that zeaxanthin and mesozeaxanthin is concentrated in the most crucial or critical part of the retina that helps you with fine acuity, vision, color vision, and it has a defensive role and fights both as an anti-inflammatory and an antioxidant within the back of the eye. There are some supplementation or research that use mesozeaxanthin as a supplement, and they largely are very positive for many different things within inside the eye, visually, for protection against aging eye diseases. And there's even some now evidence that it helps reduce inflammatory cascades that are involved with atherosclerosis, and they're using it now to research on its effect on Alzheimer's, brain diseases, even liver disease. So I think it's largely very positive. All the research I've read on mesozeaxanthin is extremely positive for not just the eyes, but even for other parts of the body potentially. So thank you for that. I do want to give thank you for the kind of the super chat or Barb giving it $2. Thank you. Everything a little does help. And super sticker for Catch. Thank you for entering that. So thank you guys so much for being here. We are running low on time. Just to be mindful for everybody, we are planning on doing more live streams in the future. If you would like to make sure you don't miss our live streams, please make sure you're subscribed. You can become a supporter of the show if you wish, and we'll always have additional resources in the descriptions and the show notes. So thank you guys so much for being here. It just means a lot to have everyone here. So hope you guys all have a wonderful rest of the day, and we'll keep this available if anyone wants to rewatch, re-listen. So have a good night, and we'll talk to you later.